So you can see the patient has teeth in his mouth, so that means that I managed to make my all-on-4. Okay, this is after healing, and this is my all-on-4, and this was the initial situation. Now let's go through my ASA protocol, right? First we take the first burr, A angled, then S straight, okay, that's it. Now we take our pilot burr, straight, then angled, okay, everything good. As you can see, that pilot burr goes in maybe a little too easily. Okay, I put my 30-degree pin and I go with the angled implant side. Okay, happy with that, about almost 15 centimeters deep. Then I take my final drill, again angled, straight. Okay, angled, straight. Okay, go in, go out, go in, go out. Okay, now I take my implants, first straight, then angled. As I said, these are unique MOA implants that they have they are one-piece implant with a multi-unit abutment head. Very easy to use, and you can screw the prosthetic part with a very good torque. So first I place my straight implant, and then I use some parallelism flex that helps me place my distal implant in the good position. We call them flags, you know, that little pin that I put on the head of the implant. And now I take my angled implant. Everything goes well, I'm happy, I'm almost done, you know, I'm on the right part. I already finished my placing my two implants. This is my last implant. I'm gonna be fine, right? And now I wanna go 1 or 2 millimeters deeper. I set my wrench at 60 Newton centimeter torque, and I wanna make 2 more turns with this implant. Okay, at this moment I reached the 60 Newton centimeter torque, right? Now I wanna go a little back, you know, to release the pressure and then go again. Okay, I release the pressure, I can go. To be a bit easier, now I placed at 80 Newton centimeter torque, okay? and I want to do one more rotation and I'm done. And I go and I go and I whoa, something's wrong. What's happening? The implant is going too easily. I lost the primer stability, the implant is spinning and I am spinning too. The thoughts in my head, and now think what can you do, and there's the knowledge we talked about. I can salvage this. Okay, so take the implant out, go a little bit deeper and engage that cortical bone with the tip of the implant and I will be fine. Let's see that. I take my pilot drill, and if you look here, the pilot drill will go in very slowly because it's a really tough bone. I am at the base of the mandible. It's like trying to drill in a rock, but you see, pressure little by little I just go deeper, and I want to go 1 more millimeter, and slowly I am able to go. I was at 13 millimeter depth, now I want to go to 15 and place my implant. You see the black mark is starting to disappear, and when it does, I'm at 50 millimeter depth. Okay, now it's very important to take the drill that is exactly the diameter of the implant, because the tip of the burr in that cortical bone has to be the same as the tip of the implant. So I go again. I can tell you I'm a little bit stressed, because if I can't use this implant, there is no other side that I can put this implant. So I promised this patient immediate loading, and I really need to make immediate loading. Okay, now I stop, and from now on I want to go easily with my hand so I can really feel what I am doing. Now I have to push on the implant. I really have to push on the implant so it doesn't start to spin. It has to enter that cortical bone and engage it. Okay, go really slowly, really push on the implant. I don't want to make any big movements so the implant will spin. Okay, now let's put in that flag so we can see the parallelism of the multi-unit head, so I can make my prosthesis on that implant. I set the torque at 50 Newton centimeters. Okay, 50. Let's see what stability do I manage to gain. Okay, go 50. Okay, that's great. Let's go to 60, because I want to make just a little bit of rotation to get that multi-unit head in the good position. Okay, it goes, good stability. Great, that's my final position. I'm happy with that, and I'm exactly at 60 Newton centimeter torque. Very happy with that, really happy with that. And that's the feeling. I have to tell you, that is the feeling.